anything can help. It doesn't have to be about what I talk about. I can get topic sometimes. Yes, sir.
I've been reading articles about some of the impacts in the healthcare area because of cuts to federal programs and et cetera. And also, more recently, the two major hospitals in Seattle discontinued their residency program, which will be a great impact down the line and et cetera. Do we have any way to try to keep up with the impacts that might be happening because of decisions that are made at the federal level that impacts the health and health delivery system here where we live?
That's a great question. First, some clarifications. You are correct with regard to the way that current is destroying healthcare. Obamacare gave subsidies to people so that they could afford health insurance. Those subsidies were taken away, and so people are dropping from the rolls of Obamacare. The amount of money it would have taken to continue those subsidies was less than the amount of money that was spent in bombing Iraq the first week.
Oh, man.
All that money that we spent dropping bombs on Iran, could easily have subsidized Obamacare for everybody in the country. So yes, that is a huge problem. With regard to the residencies, they're not going away. What happened is Providence had two campuses, First Hill and Cherry Hill, that had family medicine residencies, which combined was the largest family practice residency in the country. Now that they are combining First Hill and Cherry Hill, and they're eliminating 18 positions. So it's not going away, but it's a large reduction, and that's a problem. There is a clinic, Carroll Downs Clinic, I helped found in 1983, the last remaining clinic started out Black Panther Party. And the Providence residency sends residents to that clinic, but it looks as though we will no longer get residents to that clinic. So there are impacts from that reduction. Last thing, what can we do? Marilyn Strickland was here last time. She talked about how you've got to be involved. You've got to be involved at the local level. You've got to be involved at every level you can be involved with politically, and socially and economically and every other way. Otherwise, we're going to be in worse trouble than we are now. The people who are doing this are not doing this really against study. Project 2025, they work to get to where we are, and we've got to work to get out of where we are. Yes, sir.
Dr. John, we know that budgets are a reflection of our beliefs. And right now, we cut funding to programs where people in the world were feeding, being taken care of medically, and now we are becoming, in my opinion, more cruel in the world. There are medical implications of that, with people now being able to travel around the world, and just like with the diseases that came from Europe, they're now being spread easily. Do you see some things that need to be addressed? And how do we address them so that we take care of ourselves?
Complicated. And I have to help me understand where you want to go with it. You're talking on a personal level, you're talking on a societal level, what we can do for our personal health, societal health, and the world's health.
Let's start with personal.
Okay, personal hasn't changed in millennia. You gotta take care of yourself. You gotta eat properly. You gotta exercise. You gotta move. You've got to stay in the community. In a modern society, you gotta get your immunizations. Okay? So those are really the main things. You can properly exercise, movement, doesn't have to be going to the gym. Okay? Be in the community for your mental health and for your social health. And know how to protect yourself from diseases, including getting your immunizations, using your mask on a personal level. Societal level, understanding about what are the common diseases, particularly the infectious diseases, protecting yourself and your family from those, taking care of your babies, taking care of those kids. You know, somebody asked about RSV the other day, respiratory syncytial, which is a contagious disease that generally isn't serious for adults, but it's very serious for children, for babies. And if you are a grandparent, you're spreading this disease, those grandkids are at risk. So taking care of yourself, staying in community. You know, people, it's so easy to get on the screen, and what's happening to people and the kids on the screens is really kind of devastating. And that's why they're now banning social media in schools as well they should, because the brain develops in a certain way, and it actually is changing the way these kids' brains are better adults do. It changes the way you think, changes those neural connections. People don't know how to be in community. That's one of the horrible side effects of the isolation of COVID. And then, of course, to your point about internationally, the United States used to be a place of solace, solitude, solace and help for people who had diseases around the world. First thing this administration did was cut USAID, and immediately hundreds of thousands of children died because they weren't getting food in Africa, they weren't getting food, they weren't getting immunizations, they weren't getting HIV treatments. Hundreds of thousands of people died. And that's part of the legacy of Doge and Elon Musk, cutting these programs. And again, what we can do, as Marilyn Strickland said, is stay involved. Yes, sir.
Could you talk a little bit about the impact of the rural clinics and hospitals closing on the urban?
Say that again.
Can you talk about the impact of rural clinics and hospitals closing and the effect it will have on the urban communities?
Yeah, that's hard to say because that's so